Welcome, everybody. My name is Mina Jane, and I am one of the programming librarians at the Cary Library. Very happy to be here tonight. Happy New Year, everybody. I hope your holidays were wonderful, full of happiness and joy, and getting rid of 2020, moving past it. So I wanted to quickly say thank you to the Library Foundation, which supports all of our adult programming. And I wanted to let you know that we are recording this session and we will have it on our YouTube channel afterwards. So you can always catch it if you miss something. Innessa Manning is going to be doing a presentation and we'll be taking questions after the presentation. If you put them in the chat while you think of them, I will make sure to hand them over to her after she's done. So without further ado, I will introduce Vanessa Manning. She is a certified financial planner with over 20 years of experience in the financial services sector. She is the president of our foundation, and we could not do, I feel like I couldn't do anything without her. So I'm going to keep her introduction super short, and I'm going to hand it right over to her.
Wonderful. Thank you, Mina, and hello, everybody. So I'm going to go ahead and share my screen. Just bear with me one moment while I do that.
Innessa, do you want to tell people a little bit more about yourself while we're...
Yep. I will go ahead and do that. So just want to confirm that you're seeing my screen right now?
Yep.
Okay, wonderful. Yes. Wonderful, great. So just a little bit about myself. So I spent my career working in the financial services industry. I worked primarily with institutional clients at Citigroup and Solomon Smith Barney in New York and London. And then I worked in Washington, D.C. for a financial industry regulator on regulatory policy. And then I worked over at Fidelity on public policy issues related to finance. And then as life happens, my mother was diagnosed with Alzheimer's and kind of that typical sandwich generation story. I had young children at the time and just something had to give with her care. So I left work, I left full-time employment, but what that sort of enabled me to do is dive more deeply into personal financial issues, which I became very interested in and really found those complex, just as complex as working with institutions and government entities, and certainly a lot more rewarding because they impact individuals like you and I and my mother. So I started taking some classes over at Boston University and earned my certification in financial planning. And then I spent a brief period of time practicing at a local community bank. I'm no longer working with an institution, so the advice that I'm giving to all of you, or the information that I'm sharing tonight, there's no financial compensation in my back pocket in any way. So I'm not here to sell you a long-term insurance plan, although we will be talking about long-term care insurance. So let me go ahead and transition into slideshow mode. Sorry, I have to peer at my screen because my eyes. Okay, from current slide, and make this a little bit bigger so we can all see it. Okay, so I'm not here to sell you insurance. So what am I going to talk about? Well, where I thought we'd start is getting a good understanding of what long-term care means. So this is a presentation on financial issues, so we're going to stress that for sure, but it's really impossible to pick apart just the finance piece without really understanding what you need to finance, or understanding what the costs are that you need to cover. So I think that that's important to start there. Then from that, we will talk about estate and financial planning needs around long-term care. And then I want to end with hopefully some practical pieces of advice and resources to help all of you in taking the next step. And when I say all of you, I'm assuming that I'm speaking to people that are here because they are thinking about their own long-term care needs in the future, that they are thinking about a long-term care need for another person, another loved one, maybe a spouse, or maybe you're an adult child taking care of a parent. I'm also assuming that maybe there's some people here tonight that have an immediate need. And then there might be other people here tonight that are just kind of getting started and trying to understand things to plan for the future. So we're sort of gearing it to everybody. And I'm happy to take questions, as Mina said, at the end. And if you want to type those into the chat at the bottom of your screen as we go along, that is fine too. So thank you for that. Okay, so we will dive in. So what do we mean when people talk about long-term care? What do they mean? Well, they mean the care that needs to be given to help someone manage their health and personal needs for an extended period of time. So that means medical care, but it means more than medical care. Somebody might need assistance with meal preparation, with bathing, with maybe just social company. So there's care that's needed beyond just medical care when you want to think about long-term care. And I also think it's important to think about it over a spectrum. So it's not kind of a one and done type of thing. You might, if you're the one that's needing care, there might be a limited amount of care that you need at some points, and then you might need more care later on. So there's really a continuity, and it can vary. The costs associated with that care and the amount of care that you need can vary depending on what's going on your life. Long-term care involves just so much, so many different aspects. There's the legal and the financial aspects, of course, but there's also family dynamics. You know, how if there are a couple different caregivers that are involved that are family, do they share the same thoughts and opinions and philosophies, or is there going to be some conflict there? So that can be tricky to navigate through. There's also cultural components that are important to take a look at, and expectations. And then the person who needs care, sort of their social, their own socializing, and so friendship circles and partners and things of that nature. So there's a lot that comes into play that can really be challenging, frankly, challenging to navigate. And when I was putting this slide together, I was like, oh no, I'm going to make a scary slide. And I don't mean to do that out of the ballpark, but care that people need is often very expensive. So I have some statistics up here about what average monthly costs are in the state of Massachusetts. And we don't need to dwell on these numbers, but I think the basic takeaway is that paid professional help can be very expensive. And it can be daunting to look at. So you're not only dealing with kind of these this myriad of different issues and dynamics, but you're also dealing with, okay, what is this care going to cost? So these issues can be hard. There's no way around it. And what they can lead to are very difficult conversations. So 92, according to this one survey, 92% of people say that they know that they need to talk about long-term care with their loved ones, but only a third of those actually have had that conversation. So I think people realize that these are important conversations to have, but it can be hard. It can be hard to raise them. If you're the person needing care, it can be difficult maybe talking to your children about it because you don't want to burden them. If you're an adult child and you're thinking about your parents and taking care of them, it can be hard to raise the subject because you don't want to offend them, and or maybe it's hard to get your mind around the fact that they might need help in certain areas. So it can be really difficult. But not talking about it doesn't mean that it goes away, for sure. So these are conversations that I would advise that everybody should be having. You should have them as early as possible. You should have them as honestly as possible. Communication really is key here. Because chances are you are going to need, you or your loved one is going to need care at some point. 7 out of 10 people over the age of 65 will need some type of care. Women typically need more care than men because women statistically tend to live longer. And although a third of people over 65 might not need any care, so great news there, of those that do, 1 out of 5, or about 20%, may need care for 5 years or more. And it can be very hard to project. I'm sure you've read these magazine articles or other pieces of news that will say things like, "Oh, eat blueberries every day to keep yourself healthy," or make sure you're going on a walk every day. And of course, you want to take care of yourself and take care of your health, and stay engaged, stay mentally engaged as long as possible. But if there's some type of dementia issue strikes, or some other illness strikes you, that eating all the blueberries possible in the world is not going to prevent that. So do what you can to take care of your health, but that's no guarantee that you're not going to need care, and chances are that you probably will need care of some kind. And so go ahead and make sure you're having those conversations about it. So, recognizing that these conversations are scary, I kind of put this slide together because there are people out there that can help. And maybe there are multiple people that help you in these conversations. So one really good starting place is something called the Conversation Project. This is an organization, I believe they're headquartered in Cambridge, so not too far away. If you Google them, you will find a great number of resources, including a conversation starter toolkit, so something that you can print off and download and help you have conversations with a loved one, or just go through those questions on your own first and figure out what your answers are to them. So that's a really good place to start. They also, I believe, have referrals to social workers that can help facilitate some of these conversations. So that's one great place to get started if you know that you need to have these conversations and you've been hesitating because they seem really large and really scary. So the Conversation Project is one great place to. And other sources are, if you've worked with an estate planner or a financial advisor that you trust, those can be great people to help you facilitate conversations. Going through your estate planning documents, and we'll review what those are. That can be a great way too of forcing yourself to think through who would you want to appoint as your healthcare proxy, and would you want to have a power of attorney in place. So some of those can force, so coming up with those estate planning documents can kind of force you to have those conversations, as well as your lawyer or estate planner can sometimes help you facilitate conversations with others, as your financial advisor, if that's somebody that you trust, can do that as well. Your medical professional, so your doctor, can also help with those conversations. Maybe that's a primary care physician. In my mother's case, so she was diagnosed with Alzheimer's. Her neurologist was just an amazing professional, and really helped me in a variety of different ways understand how to give her the best care possible and how to have conversations with her about what care was needed. So talking to your doctor about your questions, even if they aren't strictly medical questions, you might find them a very great resource and very knowledgeable. So I would recommend that. There's also this whole field of geriatric case management. So these are trained and licensed social workers that specialize in knowing resources for seniors. So they could be good people to speak to as well. Sometimes they're associated with hospitals. So sometimes you might speak to them from a referral from your doctor. Other times, there are also ones that practice in their own private practices. So you can also find them that way as well. So there are other people, another professional that is very fluid in family dynamics and managing some of those conversations, as well as being a linchpin and understanding what resources might be available to you. And then sort of lastly, what I found very helpful myself personally is speaking to staff and home healthcare aides, because this is what they do. They take care of people for their long-term care needs and have seen a variety of situations. So along the way, I received some key pieces of advice from them. So that's another resource that even if you're not looking, maybe it's not an immediate need to move into an assisted living facility or some kind of a longer term care facility. But you think, oh, well, that might be something that I might need to do down the road, or I might need to do for my parent down the road. Tour those facilities earlier on in the process, and the people that you're going to speak to are going to have seen a lot of situations and can give you a lot of good advice, and you'll get a lot of insight, even if it's not an immediate need. So sometimes thinking ahead and doing things like that can be helpful. I chose this graphic of people sort of chipping away at this this big ice block on purpose, because again, just like the care that's needed on a long-term basis is not one and done. It's not one situation. It can change. It can ebb and flow. So can these conversations. You don't need to address every single thing in a 1 hour conversation. You can kind of have 15 minutes here, 15 minutes there, and chip away at it. But the important thing, I think, is to talk to your loved ones. Make sure that your family and people that might be involved in your care understand what your wishes are, and what information and resources that you're working with. That communication is key in ensuring that your wishes are met. Okay, so we talked about, here's the financial piece. So we talked about how it can be expensive. It can be expensive arranging for long-term care. So what are the buckets that you can dip into to help finance that? Well, of course, you have your personal income and savings. So these are money that you've saved over your lifetime and any current income you have. So that's one bucket that you can utilize. Another bucket is Medicare and Medicaid. I probably should have had two different squares for these because these are quite different. So Medicare is going to cover medical costs, but it will not cover what they call custodial care, so personal care on a long-term basis. Medicaid, however, will, and Medicaid here in Massachusetts is known as Mass Health. However, your assets and your income have to be below certain thresholds that are fairly low. So for a lot of people, Medicaid is not an option, but you should know what those thresholds are. And if you are somewhat close to those thresholds, there are some financial planning steps that you can take sort of around planning to utilize utilize Medicaid at some point in the future. And that's sort of this whole field called Medicaid planning. An estate planning attorney can talk to you about this and can certainly be a good point of reference, as well as a geriatric care worker or a social worker would have information for you as well on that. So that's sort of one bucket. Those are sort of the government programs that can help. Other things are insurance products, such as long-term care insurance policies, life insurance, and annuities. We'll talk a little bit more about long-term care insurance on the next slide. So I'm not going to get too detailed here, other than to say that it can be expensive to take out a long-term care insurance policy. And they're a relatively new-ish insurance plan or insurance product. And so when they were first issued, they were much more generous in benefits. So if you are fortunate enough to have an existing long-term care insurance policy that you've had for 15, 20 years, you are probably going to have better benefits than if you were to take out a new policy now. So that's one thing to note. Another thing to note is that as the older you get, the more expensive these policies are. And the insurance companies have really tightened up who's insured under these policies. So I, for one, because my mother had Alzheimer's, I am probably not insurable. Most insurance companies would not allow me to take out a long-term care policy because my mother had Alzheimer's and there's a genetic kind of predisposition to that as a child of someone who suffered from that disease. So sometimes you cannot take out a long-term care insurance policy. So sometimes that can be an option for you, but that can also not be an option if you're not insurable or if you're at an age where that makes the premiums unaffordable. So other things you can look at are life insurance plans. So if you have an existing life insurance plan, a cash value that you can take out from that plan. Some life insurance policies as well allow you to add on extras. These extras are called riders, so extra clauses. They come with an extra expense, but an extra clause that would allow you to utilize proceeds from the policy for long-term care. So there might be some long-term care riders that are available through your life insurance policy. So that's one thing to look at if you have life insurance, to understand, is there any cash value, so money that you can withdraw from that insurance policy while you're still living, and or could you add on any type of long-term care rider onto that policy? So those are some questions to look at there. Annuities, this is another type of insurance policy where you pay a amount of money upfront, and in the future you get back a stream of income. And annuities can either be immediate, so that stream of income could start immediately, or it can start at some point in the future. And just like some life insurance policies, you can add on a rider to cover long-term care. Some annuities also allow you to add on riders to your annuity policy too. So if you have an existing annuity, or that might be something that you're interested in and you're thinking about long-term care, you should find out, okay, what's the extra if I wanted to add on a long-term care rider to my annuity product? So those are some questions there. You can also, and these are questions for a financial planner, and you want to be very dependent on your own personal situation and finances. But perhaps you purchase an annuity that's going to pay you that steady stream of income for some kind of upfront charge, and that annuity payment can help cover the cost of your long-term care insurance policy. So sometimes it might make sense to take out both, so you're getting a stream of income that helps you pay for that long-term care insurance policy. Sometimes that can be done in unison, and that's helpful. This final box I have on here is home. So I think for many people, their house becomes one of their larger assets. And this is not the first place that I would go in financing long-term care, but if you're at a point where some of these other options are not options for you, looking at your home and trying to figure out how to monetize that can be helpful. So one thing you can do is, of course, you could sell your home and get the proceeds from that. You can also rent out your home and downsize to a smaller apartment. So have the income stream from renting out your home supplement, the amount of where else you're living. So that's another option. Some people get really creative and might rent out rooms in their houses. That's a possibility too. And then the final one, and I'm saving this for the last because I certainly don't want this to be interpreted to say that, oh, Innessa said we should run out and do this thing called a reverse mortgage. But a reverse mortgage is something that can be helpful in certain situations. It can also be very dangerous too, which is why I'm sort of a little reluctant to talk about it, but I feel like it's important to think about with this whole basket of looking at your financial options. So basically what a reverse mortgage is a bank will pay you a monthly amount based on your age and the value of your house for the amount of time that you are living in your home. Now, there's always a get you, and the get you here is that you have to be living in your home in order to qualify for a reverse mortgage. So if you move out of your home to an assisted living facility, or you pass away, then the loan becomes due and payable. And either you or your heirs would need to pay that loan off, or your home is sold and then covers that amount of debt. So it's the type of thing where if you have a lot of home equity built up, you don't have access to insurance policies to pay for long-term care, you want to age in place, your home has been reviewed, and you are comfortable that yes, you can age in place in your home, and we'll talk about that too in a minute, then a reverse mortgage might be something to look at, but you should recognize that that comes with the risk of not having your home as your asset any longer, because it becomes an asset of the bank in order to pay for the loan. So just sort of tread cautiously there, but it's an option on the table. And I think that's important. I think it's important for people to be as creative, to recognize that there's some creativity, and there are options available to you if you run out of your savings. I think that's what makes, I mean, I know that personally, that's what sometimes keeps me up at night. And I'm sure that's what keeps other people up at night too. And I think it's important to realize there are some other options that can be explored if needed. Okay. So we'll move on. So long-term care insurance. So I talked about this. I talked about the fact that generally the older you are, the more expensive these policies are. And at a certain age, or depending on certain medical conditions you might have, you might not even be insurable. But if you are, the things that you should know about long-term care insurance policies are that there's usually a cap in the benefits that the policy is going to pay out. And that will usually be capped by an amount of time. A standard amount of time is 2 or 3 or 4 years, and or a dollar limit. So up to, that's usually typically a certain amount of money a day that the policy will pay you back. So I've heard people say before, oh, I'm not worried about my long-term care because I have a long-term care insurance policy. And if you have a long-term care insurance policy that you can afford to pay the monthly premium, that's great, that's wonderful. But you should understand that it might not cover 100% of what you need. Because again, it is generally capped by time and a dollar amount. You should also understand that before you can begin receiving benefits, usually there's some type of benefit trigger where you have to meet a couple of different criteria. And the criteria typically are that you need help with 2 or more of the ADLs, they call them, the activities of daily living. And there are 6 of those. And what they are help that you need help with dressing, with bathing, with eating, with transferring, and that means with mobility, getting from one place to another place, continence and toileting. So I think that was 6. It might have been 7. So the continence and toileting might go together. But those are the activities of daily living. And typically, in order for your long-term care insurance policy to pay out, you need to need help with 2 or more of those. So how does that actually work? So, my mother actually had a long-term care insurance policy, and I kept reading that. I would read her policy. I'd read that 2 or more, and I finally just called the company because I could. So who decides that? So what happens is they bring in a caseworker, and the caseworker interviews the person providing care as well as the person who needs care, and that person makes the determination. Is that person ready to receive care? So why am I telling you that? I'm telling you that because it's not an immediate thing. You, as the person who's insured, you don't get to just call up the insurance company and say, okay, I'm ready for my proceeds now. There's some steps that need to be taken, and that's going to take some time. So you need to have the caseworker come out. That takes some scheduling. There's also what they call an elimination period. And that is the period of time between when the caseworker will say, okay, you qualify for benefits, and when the benefits actually begin. If you're looking for ways to lower the cost of your long-term care premiums, having a longer elimination period can typically lower those costs. So that might be something to look at if you're thinking about taking out a long-term care insurance policy. And if you have one, you should certainly know what your elimination period is and be able to figure out a way to pay for care during that elimination period. Sometimes it's 30 days, sometimes it's 60 days. I've seen policies that are up to 90 days. So it's sort of that 1 to 2 to 3 month period, plus the time it takes for the caseworker to be scheduled to come out to your home, do their evaluation, and make their recommendation. That can definitely add another couple weeks onto the situation. Okay, so so you need to sort of meet those hurdles before you begin receiving benefits. But the good news is once you begin receiving the benefits, they can typically be used in a variety of different settings. Your home, maybe it's a day service for hospice care, for a nursing home, for a memory care facility, for an assisted living facility. So there are a variety of different places that you can use that care. I would say, like I said at the beginning, is there's really a continuum of care that one typically needs over this long-term period. So if your policy is capping the benefits by a length of time, you don't want to begin receiving the benefits too early. You want to wait until you can really utilize the total amount of the maximum amount of money that the policy is willing to pay. So let's say you might need help. You might need help with 2 or more of the ADLs, but you can get by on somebody coming into your home for a couple of hours a day. It might not make sense to begin receiving benefits right away. You might want to wait until you need more help, so you actually end up receiving more money. So there's a little bit of a trade-off that you're going to want to try to figure out. And again, this is another important reason to make sure you're talking to loved ones that will be helping with your care and as many family members as possible, so they can help you think through this type of thing, because it can be a complex decision. Okay, so that's sort of the long-term care piece and the financial piece. There are also estate planning pieces that you'll want to be sure that you have put together. So you certainly want a will. You also want to have in place something that's called a living will, or sometimes it's called a healthcare directive. Sometimes it's bundled together with a healthcare proxy, which is the yellow square there on your screen. So a healthcare directive is going to give sort of this high level of the type of care that you want to receive. So it's going to help share your wishes with others. And a healthcare proxy is the person that you're going to appoint to make your decisions for you. And you can appoint a primary proxy as well as a secondary proxy. So you might want to, if you're a married couple, maybe you appoint your spouse and then a child as sort of a secondary proxy if the spouse is not available or not able to make decisions. And what a healthcare proxy does is that person is then authorized to make medical decisions along with you about your care needs. But that's somebody else that can speak to a doctor and has that position to say, when there's a question of do A or do B, that person has the authority to weigh in and give the doctor those directions. Another piece of the financial or estate planning puzzle that's definitely important is a power of attorney. So that is something that appoints somebody to make financial decisions for you. And it allows that person to speak to your bank or your financial institution and help you and actually do financial transactions on your behalf. That financial power of attorney, though, doesn't have to be activated until you're ready. But one thing that I learned that I actually was not that I was surprised by is that many financial institutions will not accept a financial power of attorney that's dated to be any older than 3 years. So if you've done all your estate plans, maybe a decade ago, that's great, that's wonderful, but you should be updating your financial power of attorney. So re-signing that to make sure that you have something current. I would also say that if you have any trusts as part of your estate, so if any of your estate is in a trust account, there's certain language that the power of attorney should include around fiduciary duty of the trustee, and your attorney will know what that is. But you'll want to make sure that that language is included in there. You'll want to ask about that if you have trusts as a piece of your estate. And it also is not a bad idea to call your financial institution, so your bank or your brokerage firm, wherever you hold financial assets, and say, hey, what are your requirements around a power of attorney? How recently do they need to be dated? Is it okay that I use my own form that my lawyer crafted, or do you have a form that I should use? Because not all institutions, believe it or not, are the same. So again, my mother was very diligent, had a great package of estate plans all put together with these 4 pieces, but the power of attorney piece wasn't as up to date as what her financial institutions required, and didn't have exactly the right language in a couple of situations that the financial institution needed. So there was definitely some jumping over hoops and being able to help her with transactions that she needed. So that's just sort of something that I would highlight here, that it's great to have the documents. That's important. Your lawyer or your legal counsel will help you get those together. But there's that practical aspect of actually using them that you want to make sure that you're set up to do, because that's really a key. That's really why you're doing this. Oh, and I also put a note on here too. The federal estate tax exemption for estates is much larger than it was 10, 20 years ago. It's $11 million. So many people's estates fall below that, so you don't have to worry about federal estate taxes. However, here in Massachusetts, the estate tax is imposed on estates in excess of $1 million. So that is just something to know in your estate plan, that if you are a Massachusetts resident, and I assume many of us here are, that there will be an estate tax levied on any estate over $1 million. And I think that often comes as a surprise to folks, because they hear, oh, the federal estate tax exemption has gone away or is so high that it's no longer relevant. And that's true on a federal level, but some states still have state estate taxes, and Massachusetts is one of them. So that's something just I wanted to pass along and make sure folks were aware of. Okay, the other piece of information that I find many people don't know about is something called a MOLST form. So what that stands for is Medical Order for Life-Sustaining Treatment. And that's something that if you do have a diagnosis from a doctor that you have an advanced illness, hopefully your doctor does raise that with you, or has raised that with your loved one. But if not, it's certainly something that you should fill out. So a healthcare proxy or healthcare directive is helpful in identifying the person that can make medical decisions for you. And the healthcare directive can lay out in broad terms, this is what I want. Sort of, this is in terms of medical care. I don't want excessive interventions. There's phrasing around that. But what the MOLST form does is it actually breaks it down on much more of a granular level about what types of medical interventions are made. Things like a feeding tube, or help with breathing, or medications. And so it really, I think even if you don't have an advanced illness, it's something really interesting to take a look at and to figure out, okay, if something happens to me, if I'm in an accident, how much of these interventions do I want? Maybe I want a feeding tube, but only for 2 weeks before that's transitioned out. So I would highly recommend taking a look at it. The state information says it's really used for somebody with an advanced illness, so I'm not going to dispute that. But I would say it's something really helpful to take a look at when you're thinking about, okay, what type of medical treatment do I want if something were to befall me on a very granular level. And once that is signed, once you have that signed and you sign that, your doctor signs that, it becomes part of your official medical record. So if you do need to go to the emergency room, the emergency room theoretically should have access to your medical records, and they will pull that up and they will abide by those medical orders. So that's, whereas if you have a healthcare directive and a healthcare proxy, you have to wait until the healthcare proxy then shows up at the emergency room to make those decisions, because the hospital is not going to have your healthcare directive on file as part of your medical record. So a MOLST form, I would highly recommend that you look into. And that's something available. I have a link at the end of the presentation about where you can download that form. It's a very simple, it's two-sided, it's not very complex, but it's very straightforward, and it breaks things down on a medical granular level in such a way that I think is helpful for anybody to take a look at. Okay. So I've given a lot of information. So what can you really do? What should you do now? I always like to kind of end things on that practical note. Well, I think the number one thing is, if you wish to age in place, or your loved one wishes to age in place, which so many people do, make sure that your house is set up to do that appropriately. My mother loved her house. I loved her house too. She had a garden that she had worked on for 30, 40 years. But unfortunately, her house had a lot of stairs, a lot of very narrow, steep stairs, no bathroom on the first floor. And what ended up happening, kind of the trigger where she moved first into my house and then into an assisted living facility, was she fell and broke her ankle. And she could not stay at her house. It was not set up for somebody that did not have mobility. So if that is your intention, if you want to age in place, make sure your home is set up to allow you to do that. Think about, okay, if I can't move, is there room here for a walker or for a wheelchair? Is there a bathroom on the first floor? Is there a way that I can transfer easily to a shower? And make sure you have the things that you need to, the equipment that you might need earlier rather than later. So some of these equipment can be quite expensive. So I'm not saying, rush out and buy like a lift for your home when you don't need it. But you might want to buy yourself a bathing chair, which is a chair that sits in the shower, and it makes it a lot easier to take the shower if you have some issues with standing for long periods of time. And that's something that's inexpensive, but try to think through what might you need earlier before you actually need it. Because that's what's going to help ensure that you can stay inside your house as long as possible. There are also consultants out there that specialize in that. They'll specialize in coming out, taking a look at the layout of your home and giving you advice about how to make things easier. But I can't stress that enough. If you want to age in place in your existing home, make sure that your home is set up to allow you to do that. That's sort of priority number one for you. What I would say next is take inventory of your assets and your income, insurance policy, and if you need any additional estate plans, the healthcare directive, the healthcare proxy, the will, the power of attorney, make sure that that's all updated and in place. Then create a list of financial accounts and ongoing bills with the associated contact, phone number, and account number. That is something that is helpful for anybody of any age, to be able to say, okay, this is a list of all the external organizations I have relationships with, and this is how I access them. In this day and age, certainly like, the website and the login information as well. So it makes things easier for anybody of any age. And it also makes things easier if you need somebody else to help you out with that, with anything, with any bill paying or financial transactions. And it's something that would be very helpful if you're considering, having your children help you out if you need some help, to have all that information there. Because definitely if they don't have that information and your bills need to be paid, there can be a lot of time in trying to figure out, okay, who's the electricity provider and how do I contact them? And then what's the account number for this particular location? So if you have that in one place, it makes it easier for you to be able to be organized and manage it. And it also then makes it easier if you need somebody else to come in and help you out with that. Then what you want to do is make sure that that information, that list of financial accounts, as well as all your estate planning documents, are stored somewhere in an organized manner. You want to share copies so that caregivers are informed. And by caregiver, I don't mean the maybe the home health care aide, but your loved one, your trusted individual that's going to go kind of oversee your care. Those that need to know. Make sure that those people that need to know have a copy of those documents and know where to find the originals. So again, sometimes some financial institutions require originals of documents in order for them to be observed. So knowing where that original is stored, it might be in your attorney's office, or it might be in your own home or a safety deposit box. Just making sure that that information is communicated is important too. Let's see. Oh, and this is what I touched on before with the power of attorney. You definitely want to make sure that you're abiding by any of your financial institutions' rules and regulations around actually utilizing those powers of attorney. So how recent does it need to be? And is there particular language that needs to be included in that? And then I think just think ahead. And this can be hard. This can be, kind of scary to think ahead, because you don't want to think about things at the end of life, either for yourself or for a family member, for sure. But thinking ahead helps you know how to plan. So one fantastic thing that my mother's neurologist did was refer me to a palliative care team he was at Beth Israel. This team of specialists was at Beth Israel. And they met with my sister and I because we were filling out that MOLST form, that medical order sort of life sustaining treatment form. And I had a lot of questions. I wanted to make sure that my mother's passing was as painless and easy as possible. And I just didn't have the medical information to know what decisions might need to be met in order to make that happen. But that team of specialists were great at kind of educating me on what different things meant, what selecting different options sort of meant at that end of life. And so if you're thinking about your own life, or you're thinking about a loved one's life, I think it's never too early to really begin understanding that. So a palliative care team of specialists can be helpful. Again, it's sort of also thinking, kind of going back to the point number one, is if you have a certain objective in terms of your loved one's long-term care, make sure that you're trying to think about things from all different angles of what might happen, and understanding what care might be needed under a range of scenarios, because none of us have a crystal ball, so none of us can say, okay, this is the way it's going to proceed. But looking and thinking about sort of the range of options that might happen can be really, really helpful. So thinking ahead as much as possible is sort of my final piece of advice here. And then what I have on this slide, and I believe Mina can send this out afterwards as well, so you don't have to all jot it down, but I listed out some resources. There are an overwhelming number of resources if you Google long-term care that come up. So I've tried to just sort of pick a handful that I think are helpful. So one is, if your assets and income are at a level where you might qualify for Mass Health, you should understand the rules around that. And so there's a link for that. Also, what I think a lot of people don't know about is Massachusetts will offer some in-home services. They will offer that through Mass Health. But even if you don't meet the Mass Health thresholds for income and assets, you can pay extra to have access to that care. And so that might be a solution if you're looking for in-home care as well, to explore alongside some of the private in-home care services. And then I have here a link to that MOLST form also. And then this is the Lexington Library, so I'm assuming that many of you here in the audience live in Lexington. And if you do, we are certainly fortunate to do so because our community has a wealth of resources. One is the Lexington Senior Services. They offer a variety of fantastic services and also have some social workers on staff that can help you navigate some questions. They have a really terrific resource guide that I have a link to here. So if I say, if you're going to follow anything or take anything from this program, go to that link and print out that resource. It really is very comprehensive, from resources to help you stay in your home, to resources to help you find caregivers. So I think it's pretty phenomenal and pretty comprehensive. So that's a great source. There's also a network here in Lexington called Lexington at Home, which are sort of social circles and chapters designed to help people age in place. That's certainly a resource to take a look at. And then Lexington's Neighborhood Brigade can also help with errand running and grocery delivery and things around that nature if you have needs. So they're a fantastic organization too. So that I feel like I'm just touching on the surface, but I don't want to overwhelm everybody. So those are some great resources to take a look at. So I'm going to stop talking and see if anybody has any questions.
We do, Innessa.
Wonderful.
I think, yes, I think you touched on this one, but Richard asked, how many years in a nursing facility should we plan on? I don't know if you wanted to dig a little bit deeper on that one.
So I mean, it's a really tough question. I wish there was one answer for you. I think probably the closest metric that's helpful is that one around 7 out of 10 people over the age of 65 will need some form of care. And of those 7 out of 10, 20% need care for 5 years or more. So it's tricky. It's going to depend on what your diagnosis is, if there is a diagnosis of some kind. With Alzheimer's patients, I think the life expectancy after diagnosis is 5 to 8 years, but that's not always the case. And some cognitive diseases, sometimes it can be, you don't know if it's Alzheimer's or vascular degeneration, which can have a lot longer time horizon. So it's really tricky. I guess what I can tell you as a rule of thumb is long-term care insurance policies typically pay out benefits for 2 to 3 to 4 years. And maybe that 5-year benchmark is kind of what you want to plan for. It's also going to depend on, are you going to try to live longer at home, or do you want to move in an assisted living facility and thinking that that's the community that you want to live within with an extended period of time. So that's going to play into the time horizon too. So I know I didn't quite, I hate like dodging the question like that and not having a definitive answer, but there really isn't one, unfortunately.
Yeah, I mean, that is, like you said, so dependent on so many different things.
Mm-hmm.
Yeah. So Brenda says, if you have no children, who can you trust to help with this when you're older and need assistance with these decisions?
That's a great question too, and really a really tricky one. So I think you think about your extended family for sure. Are you close to a godchild or a niece or a nephew? If that's not accessible to you, I would say look for legal counsel is kind of that starting place. Your lawyer definitely is going to be somebody that you should be in a position to trust. And so they can sometimes be that quarterback to help you with arranging for pieces of care. You should also talk to a social worker. I would recommend doing that as well. And again, there's some social workers at the Lexington employees that you can speak to as a starting place. Or you can also Google geriatric care managers, and there'll be a list. I believe there's also a list. I'm not quite sure, but I believe there's also a list in that PDF guide that I mentioned. So I would start asking people those questions. I would ask your doctor that question as well. But you're going to want to try to find somebody that you trust. In some cases, it might be your financial advisor if you have a really long-term relationship with that person. But that's highly dependent. Sometimes I would not counsel that that's necessarily your first place unless you have that type of relationship with that person. So I think legal counsel, if you don't have an estate planning attorney, that might be you want to start that relationship and then ask that question.
Oh, that makes sense.
Mm-hmm.
What will be the longest time limit of an LTC insurance?
In terms of how long they pay out benefits, I think the longest that I've seen is 5 years, but I think those are some of the older policies. So basically what happened is, I think I was rambling about this a little bit, is it's a relatively new insurance policy, maybe like 25, 30 years old that type of product has been out in the universe. And when insurance companies started writing those, they were more generous. And then as time went on, they ended up having to pay out more money than they anticipated. So they've tightened things up quite a bit. So I think typically what is average now is about 2 to 3 years. And they pick that because, and this kind of goes back to how long should you plan to be in a nursing home, is that typically on average, somebody might live in a nursing home. I think it's 2.5 years for men and 3.5 years for women. But again, that's on average. So you don't know if you're going to be exactly that person that's going to be the mean of that situation, right on the nose. So yeah, so I think 5 years is the maximum. 2 to 3 years is more likely.
Okay. So Catherine says, long-term insurance. I've been thinking about getting this for years, but have not yet signed up because I've been overwhelmed, paralyzed by the choices involved.
Yes.
Agreed. Policy
Yeah.
through work or independent, what kind of benefits, etc. What's a good enough approach you'd suggest for someone who just wants to do something sensible?
Yeah, that's a great question. Insurance it's honestly this really murky world. I mean, if you want to buy a stock, you log on to your brokerage account and you put in an order for your stock, and you kind of get the price quote and you execute it like right there and then. If you want to buy insurance, there's no one central place to look up all available insurance products. What I would recommend is going out to a couple of different insurance brokers. Again, I believe there's some agencies that are listed in that PDF guide. You can also Google insurance brokers in Lexington, Massachusetts. I would recommend going out to more than one, because the way insurance works is that you have to be licensed. So you have to pass an examination in the state in order to sell the insurance product. But then you have to be authorized by the insurance company to sell their particular insurance product. So many brokers are not authorized by the entire universe of insurance agents or insurance companies. They might work with a couple of different ones. So I think going out to a couple of different insurance brokers, explaining what you're looking for, they're going to take some information from you. So it is a little bit time intensive because they're going to ask you a whole list of questions about your age and your medical condition. And then getting responses back from at least 2 people, I think is really helpful. It can be difficult to compare the benefits, because again, these are policies written by individual insurance companies, so they don't look the same when they come back with the results. It's not like they're going to say it costs $300 a month. We'll tell you that it'll cost $300 a month, but there won't be one thing that it's going to give you. It's going to give you a couple different factors. So if you go to that slide that I shared about long-term care insurance, those are some things that you want to look at, so that you can try to make an apples and apples comparison, which is what dollar amount is the policy capped at? Like, what's the maximum amount it's going to pay for benefits? Is there a time cap? So does it pay for only 2 years, 3 years? Maybe you'll find one that pays for 4 or 5 years. So what are those caps? You want to look at what the elimination period is. So what's that length of time between qualifying for care and when benefits start to pay out? Some insurance policies will pay you. Other insurance policies will pay your provider. So that's something else to look at. It's better if well, in some situations, it's better that it pays you, because then you have control about where you're spending it. In other situations, it might be easier just to pay your provider, but that's another factor that you might want to weigh in on. And then you're going to want to look at what services are covered, what types of care are covered, and make sure that it's a pretty comprehensive list of home health care aid and nursing home and assisted living memory care facility. So if you kind of look at that list and come up with those, I think there are 5, sort of criteria, and then begin looking at those elements of the policies across the policy, that will be helpful. A good insurance broker also will put together a 1-page for you that will help you compare the policies. So hopefully that's somebody that you can find as well to help you do that. But it is a complex area, so it certainly, I can understand why it's been difficult, and it's not so easy, unfortunately, to do.
Yeah.
There's one more thing, if I can interrupt.
Mm-hmm.
I had a relative, when we did all those things to find the insurance company, it was advertised nationally and had a reputation.
Mm-hmm.
Turns out you would add one more criterion: getting the insurance company to pay. This company found all kinds of reasons. We lost the forms. The doctor has to redo the exam. And then the best one of all was that the person who has to approve the check that goes out to you, he's on vacation this summer. He'll have to wait till September.
Oh, gosh.
So it took nearly a year for anything to happen. And it's a firm, if I told you the name, you'd say, oh yeah, they're fine. But I did talk to an insurance broker about firms' reluctance to pay, and he just rolled his eyes and sort of muttered to himself, well, yes, that's a problem.
Mm-hmm. Yep. Yeah, I mean, that's a sad story to hear about, but I think you're right. I think the insurance companies are incentivized, obviously, not to pay out, which is unfortunate. It's their interests are not necessarily aligned with who they are insuring. So it does help to choose an insurance company that you know of, that has a reputation. You do want to make sure that they're reputable, because you also don't want them to go out of business, because that is another risk as well. Although hopefully that does not happen, or that's not a company that you're referred to. But there is some amount of due diligence in looking at the insurance company itself that's important to do.
Right. And you do hear about things like scams and frauds and things like that.
Yes.
So doing your due
Yep.
diligence seems like it's really important.
Yes. I mean, that's a whole separate program, Mina,
Yeah.
to talk about. I mean, very, very unfortunately, people try to take advantage. I have war stories with my mother, even as attentive as I was, with caregivers that took advantage and did things that you basically stole. And it's very sad that happens.
Yeah. Is the MOLST form different for every state?
I believe it is, because I did send, my in-laws live in New Jersey, and I found theirs on the New Jersey government website. I'm not sure if they have different choices or not, but it's on a different a template. So I would definitely go to whatever state you're looking for that form in. All the states should have them, but I would utilize the one for the state or download from the state website.
Thank you.
Mm-hmm.
What are your thoughts on a life plan community, CCRC, where one facility offers a continuum of care from independent living, assisted living, on-site SNF unit? Some are for profit, others are not for profit.
Mm-hmm. So it's really going to depend on what you're looking for, sort of that community that you feel comfortable in, and you know, I think it is important to think ahead. So there's some assisted living facilities that have the infrastructure in place to do more nursing types of services. So one thing that becomes important towards the end is mobility, transferring somebody if they're bedridden and can't get up on their own, and you need a certain kind of lift service or lift implement to help with that. And not all assisted living facilities have that. I know when I was touring places for my mother, that came up as something that I hadn't even thought about asking about. But I think that's important, because you don't want to transfer or start living in one facility and then have to move again to another place. So I think it is helpful to try to find some place that has a continuity of care. As to which one, though, it's really going to depend on what you're looking for. I mean, some people are looking to downsize and really like that assist, you know, don't want to deal with cooking meals anymore and cleaning up after their house, and so they're really looking, but they're still you still really want that social piece and ability to make plans on their own and go out from, you know, not to just be on site. And so for them, you know, having a long stay at an assisted living facility before they need assistance with those activities of daily living, that becomes important. I would say different states also have different things available to them. So again, going back to a personal story about my in-laws, they live in New Jersey. They are members of a retirement organization. It's a non-for-profit one, but it's kind of, it mixes a long-term care insurance policy in a way where you're paying a certain amount a month, and you continue to pay that same amount. It might go up a couple percentage points, but it's kept relatively the same. And then you utilize what care you need, either within your own home or at an assisted living facility or at a nursing home. So they have kind of different buckets for the different care levels that you need. But you have to sign on and begin paying before you actually need the care. So that's an interesting model. And when I sort of helped them with some of their due diligence around selecting that, and at the time there wasn't something comparable offered here in Massachusetts, that at least that I had identified. So it's definitely good if you're caring for somebody out of state, to do the due diligence of what might be available in that particular state. It might be different than what's available here in Massachusetts.
So it sounds to me like timing is everything, and that you should try to get the least amount of care needed, you know, as, you know, not to get the most care right away, because of course everything gets more expensive as it goes. So if you
Right.
don't need
Right.
the assistance with daily living, then, you know, you stay at the level less than that.
Right. Right. Yes. You don't want to be paying for services that you know don't need before you need them, but you want to have that available to you if you do need it, and you might need it, or somebody might need it relatively quickly. So that can change.
Right. Carolyn says to remember that there's Minuteman Senior Services
Yes.
as well.
Yep. That is another great resource. I didn't list them there because if you go to the Lexington Senior Services website, they have a link to the Minuteman Senior Services, but they offer a wealth of information too. They also offer what is called Shine counselors. I don't know what that stands for. It's SHINE, but those are people that free of charge will help you with Medicare plans and selection, which can be really helpful. I believe they might help with Medicaid as well, but they're sort of a wealth of information and resources, and I believe they have social workers on staff too.
Okay. This is an interesting and good question, I think. Would it be better to try to save money to cover your long-term care expenses on your own without a policy?
Yeah, so that's something that you definitely want to look at. Again, I don't mean to be dodging the question, but that really does depend on your own personal situation and how much a long-term care insurance policy is going to cost you. So again, as I mentioned, because my mother was diagnosed with dementia and passed away from complications with Alzheimer's, I'm not insurable. So that's not an option for me. So that might be, one thing sort of out of the gate, maybe you're not insurable. Maybe you are insurable, but the price point is so expensive that it makes sense to what the industry would call self-insure, which basically means pay out of your own pocket. So you want to weigh, I think it's important to understand how much the long-term care policy might cost you, so that then you can make that trade-off as, am I better off not paying that and self-insuring or paying out of pocket? And that's whether or not you can do so is going to depend on your other financial situation, what other assets you have available to you.
What happens if you put all this money into a long-term care policy and you die in a short time and you don't use it?
Yeah. Again, it's going to depend on the policy. Sometimes there's some, if it's a rider to like a annuity, sometimes there can be a survivor benefit. But a typical long-term care policy, you're exactly right. If you take one out, you pay it for a couple years, but then you pass away before you utilize the benefits. Yeah, it's gone. That is definitely true. And the insurance companies, I don't mean to be beating up on insurance companies. They do serve a valuable role in kind of our society, but at the same time, that's the evaluation that they're making. They are for-profit entities that are issuing policies that they end up making money from.
Is there such a thing as a paid-up policy? Like I bought long-term care policy a long time ago, and I don't want it, but can I say, well, okay, this is as far as we'll go without sacrificing it ever?
I don't believe so. So what you should do is call call the insurance company and ask that question, but chances are no. Chances are as soon as you stop paying the premium, you're no longer going to get access to the benefits.
Right.
Yeah.
Okay, so I have two more questions. How do you determine a good, reputable insurance company? Which to me means, what are the questions that you might want to ask? What does the due diligence look like?
Yep. So the state has really good information on which insurance companies are registered. So you definitely want to make sure the company is registered with the state. And what that means is that the state is examining. So states are responsible for overseeing insurance companies in the U.S. So you want to make sure it's a registered entity. It's licensed to do business here in the state of Massachusetts. I would say you want to make sure that it's a name that's known to you. If you don't recognize the name of the insurance company, that might raise some red flags. I mean, typically they're large organizations that have kind of that financial capital to be able to pay out their policies. And because they're such large organizations, chances are you will recognize their name. But if you don't, you might want to question that. You might want to question your insurance broker. So you kind of ask them that question, how can I trust this insurance company? Why are you recommending this one to me? So that can be a great resource. You definitely want to, I would definitely do a quick Google search, kind of, you can learn a lot from sort of chatter online and reviews. So kind of try to do that kind of due diligence and online searches too. So those are some ways to get started. Those can be questions as well if you are working with the Senior Center or working with Minuteman Senior Services. Those can be questions for them too.
Okay, quick follow-up question, then I have my last question. Would it be better to go with a local or state-based company instead of a national one, or would that be worse because they could go out of business?
I think I think both can be viable options. I don't necessarily think there's one clear choice. I think you need to consider the amount that each is charging you and the benefits that they would provide. I think that's an important part of the puzzle. Typically the larger the organization is, the stronger base of capital it has. But as we saw from the credit crisis from 2007, 2008, with AIG, which is such a reputable organization, they had trouble meeting their obligations. So things can happen, events can happen. So it's hopefully not common, hopefully is not going to happen, but can be the case. So I would say it's not necessarily, it's not a clear out of the box decision. You have to consider some of those other factors as well.
Okay. So my last question is slightly facetious, but slightly not, is I couldn't believe that Tom Selleck was selling reverse mortgages. He was a spokesperson for Spokes. And my question is sort of like, he's not an expert, just because we feel like we know him, we should, it doesn't mean that he knows what he's talking about.
Right.
So it's not a scam, but it's definitely something that people should pay attention to.
Right. Yes. And again, I mentioned reverse mortgages as a sort of one of many options to look at. It certainly comes with its own set of risks. For sure. So you want to understand how they really work, and make sure you're doing your due diligence before you purchase anything. That's really important. And spokespeople are, they're paid for what they're doing. So just because we might like him, think about him from years past, doesn't mean that we should trust what he's recommending.
Right, exactly. I mean, I saw Alex Trebek doing something too, and I know that they're paid spokespeople. And I'm sad about Alex, but I still wouldn't take his word for something.
That's important to highlight. And I think it is true. There's a lot of information and a lot of people that try to scam. They try to scam people that are older, and the scams can be very sophisticated and very sophisticated and well done, that anybody can fall for them. So it is tricky, unfortunately, and people are getting better and better at scamming and misleading.
Right. Well, thank you so much, Innessa. This is amazing. I've been getting thank yous from every people that had to go on how wonderful this is and so helpful. I did want to say that you're going to be back on February 24th. It's a Wednesday, on another topic on taxes. So people keep a lookout for that. We don't have it on our calendar yet, but we will soon. And just thank you. This is really wonderful. I appreciate your expertise on this, and I think other people, the people that were here, also did.
Great. All right. Well, I'm happy to be here. And I would say too, so this is sort of one program in a series that we've been doing on financial basics. So we've done one on budgeting, one on savings, one on the basics of investing, this program, and then we have the one coming up on taxes. But if there are particular questions, if there are folks that are still here that have, or topics that you're interested in diving into, please don't hesitate to let Mina know. And maybe it's a case where I don't have the expertise, but we can try to find somebody else in the Lexington community to come on and sort of do a Q&A, and get some of those questions answered, because I know it's complex. It's not easy, and it's not straightforward.
Mina, will you be sending out that resource list?
I will send out the resource list. I will send out the link to the video, and I think I'll send out the links to the YouTube videos from the programs that Innessa's done in the last 3 months as well.
Thanks so much.
No problem. So thank you everybody for being here. Thank you, Innessa, again, and I hope you all have a wonderful night.
Okay. Thank you all.
Thank you.
For